Hello everyone, welcome back. Today I will be talking on anemia, and it means the lack of blood in the body. So before I continue, I would like to subscribe to my channel and turn on the notification bell to know when we have new health videos for you. Okay, anemia is the reduction of the red blood cell. What is the red blood cell? It's part of the blood cells we have. We have the white blood cells, the red blood cells, and then we have platelets. The content of the red blood cells include hemoglobin from iron and oxygen. Red blood cells stays up to 120 days before it dies off. What happens if there is anemia? There is a reduction in the red blood cells. It lowers the oxygen carrying capacity of the blood. It shows that the person can be ill or has a disorder or has nutritional deficiency, or it can also show that the body is unable to produce sufficient number of red blood cells to sustain the body as at that cycle. Or it can also mean that the person's blood cells quickly destroy, so probably doesn't take up to 120 days before it is destroyed. If the person is bleeding from menstruation or gastrointestinal problems, example, bleeding from ulcer, inflammatory bowel diseases, or anybody that went through surgery and person bled so much. We also have nutritional anemia, when there is nutrient deficiencies that could hamper the production of these red blood cells. Remember, I mentioned that iron is responsible for the production of hemoglobin. If you have these deficiencies I'm going to mention, then it means that it can increase the chances of having anemia. Deficiency in iron, vitamin B12 along folate. Others include vitamin E, vitamin B6, and vitamin C, of which iron can be absorbed in the body without vitamin C. So what are the causes of this anemia? One is malnutrition, blood loss, whether bleeding or any other form of blood loss, when your body is unable to absorb iron or nutrients that can produce the red blood cells. Chronic diseases, medications, so that's why you need to check the side effects or contraindications so you don't worsen your condition. Impaired coagulation, genetic defects, then drug interactions. When you're taking probably drugs and herbs at the same time, the two of them can interact. When you're taking a drug with a food you're not supposed to take together, that can also interact and can cause anemia. So how do you treat or manage anemia? Through blood transfusion, most especially eating right, iron containing food. Previously I've talked about some iron rich foods. You can get them from animal sources, so you can go down to one of my videos where I talked about foods that are rich in iron. That could help. So for those who are vegetarians, you can get iron rich foods from legumes, dark leafy vegetables, and some tubers with the bark. Most people who are anemic might not be able to menstruate if you're a female, and it can also lead to shock and probably immediate death. However, anemia is associated with these kind of symptoms: lightheadedness, blurry vision, constant headache, sometimes tingling or numbness, lack of appetite. But it's quite better that you go for a lab test to confirm if you have anemia. And if you have excessive blood, try and donate blood and lead a healthy life. Until next time, on your health. Thank you so much.